everyone. Today I am with Anna Bolshin from Loving Touch PT, and she serves the Montgomery and Bucks County, Pennsylvania areas. Anna, welcome, and I'm so excited to chat with you about your business as well as the families that you love serving in Pennsylvania.
Awesome. Thank you so much for having me, Lauren. It's a great, this network that we're creating is a great thing to support parents, right? We're in the game of supporting parents and facilitating kids' development. So how awesome is that?
And it's fun for us too to be able to collaborate and get to know and learn from other pediatric physical therapists all over the country.
Yeah, for sure, right? Because we all specialize in our own areas and we all have our niche. So it's so nice to be able to collaborate, learn from others. You know, I'm always a fan of continuing education. So giving each other tips on what's working awesomely, what's not working so well. So it's amazing to have a network.
Absolutely. And speaking of specializations, I love your bio and you have a ton of things that I cannot wait to dive in and to teach our families more about here on the YouTube community. But first, let's chat about, I know you are serving the Montgomery and Bucks County areas in Pennsylvania. Do you serve any other areas in the region?
Yes, so I'm in the suburbs of Philadelphia. So I'm about 40 minutes from Philadelphia. So that generally covers Montgomery and Bucks County. And depends on the case, really, any area within, a 30-minute driving distance, right? Because it is a mobile practice, I do come to the home. So just to make it efficient and comfortable for parents, keeping it a little bit manageable. That I'm seeing kiddos rather than driving.
Well, and I think the parents want that too, right? They don't want a harried therapist who's just sat in traffic for an hour to come up to their door and bring all of that car stress with them. So I think that is definitely a win-win on both areas.
Yeah, absolutely. Absolutely.
Awesome. So when you say you go into the home, I'm a home-based pediatric physical therapist as well. And so I know I love this model, but why don't you tell the parents of Pennsylvania really why you chose this model for your business over maybe a different style of model, or what you love about going into families' homes and the magic you see that happens there.
Yes, so I'm sure that you could attest to this, but being able to see the environment where your child lives and thrives and functions gives you, I don't even know, 1,000% more information that you would get, bringing your child after you just had to hurry them after their feeding, after the nap, dress them, put them in a car seat, bring them to an environment where they're completely uncomfortable. They haven't been there before, getting them used to that environment. That child is functioning in a whole different way. So we get a very different picture of your kiddo because your kiddo is comfortable. Your kiddo sees their toys. We come in to see your kiddo at a time that's generally, I try my best convenient for you in terms of nap time and feedings. So you're just seeing a much more comfortable, relaxed child, and it gives you a much clearer idea than what's going on, right? You don't have to have that 1, 2, 3 sessions for them to get used to the environment because they're already in their environment. And then when I look around your home to see what you have, what you're using, what you don't have, how you're positioning your child based on how you actually live, that allows me to tweak certain things. And when I tweak those things, that's really where the progress happens, right? So it's not about those home exercises that I give you that you're going to spend, 20 to 30 minutes a day. That doesn't really work. What works is modifying your lifestyle so that therapy becomes part of what you do. It's not about you being a physical therapist to your child 20 minutes a day. It's how do you play with them? How do you position them? Where do you put their toys to facilitate movement and to facilitate development? It's just a completely different ball game, and the progress that I see is not comparable to any setting I've been in, and I've been in a lot.
Yes. And honestly, that's, the same for me. That's why I'm such a huge advocate and why I want to get the word out to more families on YouTube to say, hey, this is an option. It's not just something that I do. It's something that physical therapists all over the country are doing. And we're really here to support and empower you. Because I don't know about you, Anna, but for me, when I go into someone's home, it's such a more calm experience for everyone. And I feel like the parents are just sponges. Like, I had this one mom who was like, you're teaching me so much. Do you mind if I grab a notebook? And she just started taking notes. And I was like, I love this. So maybe talk a little bit more about like the difference you see with parents in experiencing physical therapy in this way and how that results in them being more empowered to learn about their babies.
So you spoke about a therapist sitting in traffic, right? And a therapist who's hurried and stressed, right? Double that for parents because, and I specialize in early childhood. So really we're talking, I can treat kids of all ages depending on the condition, but really I thrive and I love 0 to 3, 0 to 5. So you've taken that child out of that routine. You've had to fit in a lunchtime. You've had to dress them. You've had to be in the car. Depending on where you live, you've had to look for parking. You had to walk into this office. Your child doesn't know the office. So you're running after your child. So they don't touch this. They don't touch that. They don't get hurt, right? Your body's in stress mode. We don't learn when our body is in stress mode. And our kids don't learn when their bodies are in stress mode. When you're home, you're comfortable, you're calm. If your child needs to have their diaper changed, it's easy to go to your usual area to change their diaper. When your body is calm and you're comfortable, you're more receptive of information, right? That patient knew exactly where to go get that notebook to take notes, instead of her sitting in your office and, will you send me this home exercise program? Well, how do I access this information, And it's this information and it's the parent's knowledge that really makes the difference, is what I say all the time. I'm there to guide you, but you're the leader of the team. So if the leader of the team has lost their guide or has forgotten what was said to them on a visit last week, where's the leader going to lead their team, So I just think it's about comfort. It's about being relaxed. It's about it not being stressful. It's about eliminating the white coat syndrome, for both the parent and the kid,
Yeah, I love that. I mean, I literally could talk to you about this all day long, but hopefully the families on YouTube are able to gather at least kind of our passion for bringing physical therapy to them and see how that could potentially lead to impacting and increasing, even truthfully, the speed, which we already kind of chatted about too, is like my kiddos get better faster because the parents are really invested and they're also confident in the exercises because, again, they're using their things, they're cued by their couch, their cushion, their bedding, where the door is. They don't have to flip images in their mind because you've walked them through all of these things.
Yep. Even if you have the ideal situation and that quote unquote easy kid where commuting and getting to an office is not difficult, and when they get to a new environment, they're really interested and excited, the equipment that I may have in my PT clinic, you're not going to have at home, right? So all of that excitement that they get from what they see, how do you then translate that into your house? Whereas at home, you don't have that issue. Your kid has their favorite toy, and I teach you how to use that toy to motivate them to move or, to do whatever it is that we're working on. It just makes it so much easier and less expensive. I think that's a whole different conversation that you and I can get into, but having to purchase everything that a PT clinic has, right, is not feasible, or should it be expected. But if we're in your house and if we're able, like pediatric therapists are so creative. That's right. That's where our mind goes. I'm a kid at heart. I say I play for a living. So I can totally figure out how to use what you have to get your child to do what I need them to do, right? And then that becomes much simpler for you.
Totally. I tell everyone all the time that I actually am a sports-based therapist that found myself in the peds world and never left because I've just been having too much fun.
Yep, 100%. We play for a living.
And I saw that on your website too. I feel like you make it really clear that your love of pediatrics has been around like your whole career, maybe your whole life.
Yep. I'm actually from Ukraine originally, so both,
Wow.
yeah, both my mom and my grandmother were teachers, and I love kids, so I always knew that it was gonna involve children. And then I volunteered in a hospital, in a physical therapy department, and just the concept of getting people moving. At that time, it was adults for my volunteer work, right? But if we can't move, it's so much more difficult to live our life, right? To access our environment, our peers, our family members, right? So movement really gets us going. And to be able to help kids get that movement, it's just you're boosting them, and to do it with kids, and that's why I love early childhood. You're changing their trajectory, and it's super rewarding.
Well, and there's so much too about just learning to move. You're learning to actually have control over your environment. You're building neurological pathways that you can use further down the road. Like I talk a lot about how some of these motions can lead to building pathways that we need for reading, writing, some of those academic skills further down the road. But also communication and kind of everything really builds off of feeding and really gross motor. And then the visual system is really helpful too. So there's a lot going on. And there's so much you can learn once you're having a baby that can be very overwhelming. So I know that you're probably on the same page as like, we want to be like your heartfelt guide so that you can really understand how your child moves. So that's one less piece of the puzzle that you have to figure out on your own.
Absolutely. No one teaches us, right? So you and I went to PT school, with our bachelor's, that's 7 years. The parents that we work with, whatever career that they're in, they've spent years, right, being educated and trained in that career, and no one really teaches you what to do with your child. And then I feel like a lot of what parents do are reactionary rather than proactive, right? You've had your kid, there is a delay. You had your kid, there is, I don't know, a torticollis, hypotonia, whatever it may be.
Mm-hmm.
And then it becomes reactionary. There's no education about how to position your kid unless you look for it somewhere yourself. There is no education about how to move your kid, how to play with your kid. And that could make such a big difference. You said it, gross motor development facilitates muscles which support our trunk, which support our legs, which help us breathe. Those weak muscles will impact breathing. Those weak muscles will impact eating. Those weak muscles will impact paying attention to a teacher. So movement really is key, right? That's the first thing we develop as kiddos is gross movement. So if you're delayed in that gross motor ability, every other developmental domain is affected, right? So a lot of my parents are surprised when their kids who walked late are also speaking later, right? But it all goes together because we have muscles in our face too. So if all of the big muscles didn't work well, all of the smaller fine muscles won't work well either. So that's why it's awesome what we do, right? And how do we get to our toys? How do we get to our friends? If we can't climb up that playground equipment, we can't play with our friends. If we're having a tough time at soccer, we're not going to enjoy soccer, So just giving kids movement, ability, confidence, I just feel like it leads to success in every area of their life.
Yes. And I think too, as pediatric physical therapists, we're around kiddos who struggle with movement so much. So I don't know about you, but I find that is like the biggest compliment with my families when they start using really gentle positive language that I'm like swooping into therapy sessions, and then they're using that language with their kiddos to really motivate and empower them, because movement is hard. If you have weakness, especially as your body gets bigger, so say maybe you struggled in tummy time, and so you're not pushing through those elbows, and so your shoulder and upper trunk muscles are weaker, and then you're trying to crawl, but it's getting a little janky in there, and so then a physical therapist comes in to try and help you do those exercises. It's not always going to be rainbows and butterflies, because it is going to be tough, because now you're bigger than you were when you were, ideally strengthening those muscles in tummy time when you're 0 to 3 months. And so now we have to make up that time, but you also have more mass, so it's more difficult for those muscles themselves.
Exactly.
So there's so much going on there, but I love that pediatric physical therapists are really filling this space for families, and also just really, I think there's a lot that parents can take from just learning about how we interact with their kiddos, but being there for that full session in-home pediatric PT.
Yes.
That they can then, I think once you have the experience of having a physical therapist come into your home, you absorb so much more than what you even think you're paying for.
Exactly. And, I find within 3 to 4 visits, they definitely start to not only talk to their kids like me, but also rationalize, right? So a lot of my parents will look at the child and, I was doing some release strategies for a little girl, and I haven't seen her in a while. And the mom said, well, I saw she was weight shifting to this side, and I saw she was bent a little bit in the trunk. So I knew I needed to release that side before, they literally start to kind of think like you, right? It's your mind is blown, and that's where the empowerment comes. So I tell the parents that I work with at intake, my role is not to kind of increase your dependency on me. My role is for me to teach you so that you could feel empowered and handle it on your own. Because again, that's where progress is going to happen. If I come in an hour, even 2 hours a week, even if it's an intensive and I see you 5 times in 1 week, right? It's still an hour a day. And then there are 23 hours left to your day, right? And so what I do is not as important as what you do, right? So if I can teach you how to do these things easily, and I emphasize easily because it's difficult. I just had a conversation the last kiddo of the day that I saw, and parents were asking me, well, what happens when we're not at home and we don't, these parents happen to have a lot of toys that were useful and we don't have these with us. And, I'm like, well, you understand the concept of what it is that we want to do. So if we're going to squat and play with this puzzle inside the house, we're going to squat and play out on the grass, or we're going to take that ball, right, and kick it with that leg. So it's not meant to be so much therapy, so much homework, right? When I worked with adults, the big hang up in the beginning of my career, right, was that home exercise program. When you call anything homework, no one is going to want to do it, adult or not, right? So how do we easily do these things? What do we do when we're in the park so that I'm taking both of my kids to the park? I can't do a physical therapy session because I have my 1-year-old together with my 3-year-old. So how do I play? How do I hold them? How do I help them to stand? How do I guard them when I'm walking with them? You do these things all day long anyway, right? So how do you do these things to facilitate development? And that's the difference between home PT, is we're teaching you how to live your life in a therapeutic way. So it doesn't become a hassle. It doesn't become, okay, now I need to find 20 minutes. Let's be real. I came home from work at 7:30, right? You tell me to do an exercise with my child today, it's not going to be done. But as I just walk them up the stairs to their room to nap, I did it in a specific way that got their body moving. You know what I mean? And that's where progress happens, is when we live with our kids in a therapeutic way, you know?
I love it. I love it. So you mentioned a little bit about kind of an intensive, and I know you have a couple of different varied certifications, and one of those being total motion release. And I saw your level 2. I just got my level 1 and I love it. And so I'm really excited for you to share not just about total motion release, but kind of about how you use these different certifications, whatever ones you want to chat about and kind of highlight, and then how that's maybe a little bit different than what other parents are expecting.
Yeah, so what I tell parents all the time is, consider yourself going to a doctor. If you have a heart condition, you're going to go to a cardiologist. If you have an issue with your GI, you're going to go to a gastroenterologist. Physical therapists are similar in that way, right? So you could have your sports medicine, you could have your pelvic floor, you're going to have your pediatric physical therapist. But even within that realm, we do a lot of continuing education on what interests us most and what we find to be successful, So TMR, you mentioned total motion release, has been a life changer for me, honestly. So I'm so glad that you're starting on that journey, because the way I explain TMR to parents is we have a structure in our body called fascia. And when you have restrictions in your fascia, it's like taking your shirt and bunching it up, right? So I bunched up my shirt here, for example. I can't bring my shoulders backwards, right? It's like I have to constantly work against resistance. So you call me in for an eval and your kiddo doesn't like tummy time, but why, right? Because if they have restrictions in their fascia, it's like lifting a 10-pound weight for a bicep curl versus lifting a 1-pound weight for a bicep curl. When you're able to identify these restrictions and help your child release them, movement just becomes easier. So suddenly they don't cry in tummy time, because crying is how kids communicate. Obviously, I was going to say that don't speak, but even those that do. So how do we make movement easier for them? How do we eliminate restrictions and challenges? So that's what TMR does for me. And in addition to TMR, quavasmetic exercises, oh my God, talk about life changers. So
tell me all about them.
Yeah, so quavasmetic exercises were developed by Ramon Cuevas in the 1970s, and he just was not happy with the demands or the challenges that were placed upon kids with disabilities, and he knew that they could do more. So he developed a technique where we use the vestibular system, which is the system that controls balance, and movement to elicit automatic responses in kiddos, right? So the child may not be able to stand, but through specific movements prescribed for that child, I can put them in a position where it's an automatic response, right? So they're not going to have a choice to stand. Their body just kind of reacts because it's sort of like fight or flight mode, right? And then within that automatic response, they eventually learn motor control. And oh my gosh, I can't even tell you. It's such an amazing journey. I hope to go to Toronto soon to meet Simona in person. Simona DeMarchi is the instructor that I've been working with virtually. That's the positive thing of COVID, is that it brought CME to me virtually. I have 2 kids of my own, so being able to do that training, it's just been absolutely amazing. But both of these theories work for kind of all conditions. You use TMR and CME for torticollis. You could use TMR and CME for hypotonia, because it's about, again, relaxing the body and then maximizing that body's potential by kind of sparking the brain, if that makes sense.
Honestly, it sounds a little bit kind of like sexy from like an intellectual standpoint. I know that sounds weird, but my interest is definitely peaked. So hopefully we have a lot of mamas who watch the channel, and hopefully they are like writing this down, like, CME, like let's learn a little bit more about that. Or hey, I'm in Pennsylvania because I'm literally Googling, Montgomery, Pennsylvania, in-home pediatric physical therapy right now. And Anna sounds awesome, and she's got this fancy stuff going on. I want her to come to my house right now and see my kiddo and help me learn about how they're moving. And really, too, I feel like both of those, again, I know a little bit more about TMR, but TMR plus CME sounds like they are very complementary, and also that the goal is really to make it a little bit easier on the kiddo, but still to elicit the goals that we want, right? Which is the increase in as much independence and movement, as much symmetrical motion as possible, strong, independent babies that, and toddlers and older kiddos too.
Yep. So basically, TMR makes it easier and CME challenges them, right? So you don't want to give a challenge. You don't want to give a challenge that's too difficult without them being prepped. So that's kind of how I look at it.
I love it. Okay. So in the, so that we can not, steal all your time, although I feel like I could probably talk to you all day, let's head over to your website, and then you can kind of walk us through. So say there's a mom right now, she's in Montgomery, Pennsylvania, or Bucks County, Pennsylvania, and she's like, all right, it is way too hard for me to leave the house right now. I've got a 3.5-month-old, and I know something is like not quite right. Maybe her head is tilted and she only turns to one direction, and someone's mentioning torticollis to me, and also maybe there's a flat spot, there's some plagiocephaly going on. All right, I found this YouTube video because it literally says Montgomery, Pennsylvania, in-home pediatric physical therapist Anna Bolshin, and I'm on her website. So what do I do? What's the next step?
So it's so many options. You could schedule a free virtual consult. So as you gave an excellent example, you see that purple, schedule a free virtual consult, and that's pretty much the section of the website. Sometimes you just need to be able to ask that question. Is there something really wrong? What do I do? How can you help me versus someone else? And then pick your method of communication, right? So I'm a little old school. Calling me is great. That's my cell phone. Texting me is great. Sending me an email. Honestly, whatever works for you, I'm here. I'm here to help. But I think the feedback that I've gotten from parents is the virtual consult is very helpful. Not everyone who gets the free virtual consults necessarily goes for services right away, because I may just say, well, your kid is on his way, give him a chance and let's see what happens, or do this and let's see if it helps and what happens. Because again, as I mentioned before, I'm not looking to create a dependency. I'm looking for you to know your resources. So if you need me, awesome. But if not, that's great. Your kid is doing well. And then again, if you wanted to learn a little bit more about me, why I do what I do, there's obviously an About Me page section there. Those are my 2 kiddos and my husband.
So cute. Look at that, guys. Adorable.
Thank you. They're a little bit older. I just, everyone, school is finishing now. So I looked at Josh is my oldest. I looked at his picture from the first day of school, and he's, almost 12 going on 18, and how kiddos change within a year. He just went from a baby to an adolescent over a day. But yes, those are my kids. And honestly, I tell them all the time, if I have to work and be away from you, I kind of really want to do something that inspires you too. So my kids know about my patients, are friends with some of my patients. It's really, really cool. My oldest yesterday saw a woman walking and said, Mom, I think she has flat feet. So he's starting to do gait analysis already. So yes,
That's
and
so
I just
sweet.
wanted to show them that you could do what you love, right? So I'm sure you've come to the area of in-home physical therapy services. I'm sure you've been in lots of different other settings before you got there. Um, and it's just truly, doing what you love to do. So that's why I do it, is my kiddos. Um, my goals are really to just support kids, right? So wellness prevention and early intervention. I think I'd love to see physical therapy becoming more of a wellness model as well, not just an interventional model. The reason I love intervening early. So everyone knows of early intervention programs, but when I say early intervention, I mean you have that kind of inkling that something's up. Do you intervene or do you wait for them to grow out of it, right? And when I get asked that question, will they grow out of it? I always say, well, do you know adults with flat feet? Do you know adults with who in tow? Do you know adults who have scoliosis, right? So that means not everyone grows out of it. And when you intervene early and when you follow that wellness model of care, you mentioned earlier about learn movement patterns, right? When you have an issue, you then learn that movement pattern in a way that's not ideal for your body, right? So the longer you wait to address an issue, the more we as therapists have to help you reverse, right? So then it becomes longer, more costly, more stressful. So, I'd love for kiddos to get musculoskeletal checks in the beginning of their life, especially, right? 3 months, 9 months, maybe if they're not walking, maybe 14 months, that would be awesome. And then my goal of caregiver education, I think we've covered a lot. It's just empowering parents to, again, be able to screen their kids and knowing what to do or who to turn to if there is an issue. Continuing education, I'm huge on. I love learning. If I could have a week of like continuing education 2 days and treatment 3 days, if that could be like my breakdown for the rest of my life, please, that's like totally me. There's always more to learn, right? And I spoke about sparking the brain. I hate stagnancy, right? And it's through continuing education that I can really provide the best possible care for your kiddos. And team approach is huge, right? So everyone needs to be involved for a successful outcome. So those are my goals. And you could schedule that consult from really any page.
Yes, it is so easy. And honestly, I love it too. So I do phone calls, kind of a very similar setup, but I always call my families, even if they like schedule online or do anything online, because I feel like if you're going to have someone come into your home, it's so nice to just feel like you talk to the person on the phone, feel like there's a really good fit, that there's rapport there. And so I love that you do the free virtual consult, because then you're able to knock off all those spaces. And also the parents know, right away, like, okay, like she's going to come in and she's like a mover and a shaker. She's not going to come in and like spend 45 minutes of the 60 minutes asking me questions. Like, no, like she's got an idea of what's going on. Obviously there will be more questions, and kind of as you go and see kind of what their environment looks like and ask questions about sleeping and feeding and all that other stuff. But you're gonna just jump right in with the kiddo because you're both comfortable with that, and really the only person left to get on the party is the little babe or the little kiddo.
Yeah, it's about rapport. A lot of it is about rapport. If we develop a relationship where you can trust me, and you know that I care, it's kids, right? Kids are the most important thing in our lives. So you have to be able to see my face and to trust me and to know that I really have your best interest in heart, and to know that, I know what I'm doing, right? And it's, it's again, it's your kid. So you want to be able to make sure that you're getting them the best possible fit for you,
I love it. And you don't just have a website, Anna. You've got a couple of social media. So let's jump into that real quick. So let's talk about Instagram first.
Yes.
So why don't you tell everybody, they probably can see your handle, but why don't you tell them anyways, and we'll kind of chat a little bit about your page.
So, yes, on Instagram, Loving Touch PT. I try to post as much as I can, but you know, when you're working with kiddos, that takes up a lot of your time. So I try to share information that I think will be useful to parents, whether it be my own or other therapists that are posting and you know, teaching parents. Right? I laugh because I say I'm a really good therapist, but I'm bad at technology, right? So Instagram and social media, I'm kind of learning as I go. But it just gives you a little bit more information about who I am and what I think is useful and helpful to you.
Then you've got links here too. Again, you're all about the free virtual consult, and I think that's so good. Parents need to have multiple reminders like, hey, I am here for you if you need me and you have questions.
Exactly.
And then you have, and here's another good place, right? If you are watching this and you're like, oh, dang it, what was that crazy certification that Anna has? I'm curious about it. I really want to just stalk it. You go to Instagram and you can just copy and paste this from Google or from her Instagram and put it into Google and learn a little bit more there. Or you can schedule a free virtual consult, and I'm sure she'll tell you more about it.
Yep, for sure.
Awesome. And then you're also on Facebook.
Yes.
But you mentioned, so I think your names are a little bit different, right?
Yes. So Facebook,
or your handles are the same.
Yes, same. Yep. Loving Touch PT, Loving Touch Pediatric Physical Therapy, and it's basically a replica of most of what you see on Instagram, right? Some jokes and memes here and there, right? We gotta put smiles on our faces. But again, I'll be honest with you, just from a time constraint perspective, you're mostly going to see me sharing things that I find to be useful to you. And then the rest I teach you in person.
Well, Anna, is there anything else that we haven't covered that you would love families to know about you, your business, and who you serve?
You know, like I said, early childhood, 0 to 5, is my jam. Love those little kiddos. And I think the message that I always try to send to parents, because I see so much of this and it breaks my heart, trust your gut. Know that you know your child better than anyone else. And know that at the end of the day, us as providers, you know, we work for you. Doctors work for you. Therapists work for you, right? So don't be afraid to stick up for your gut, to ask us questions, to be truly, like I said, you're the leader of the team and we're just there to guide you along. So that's kind of my motto and how I work and treat kiddos. And, you know, like I said, if you're in the Montgomery or Bucks County areas of Pennsylvania, reach out. And I'm here for you, right? Again, I think COVID made all this virtual stuff, you know, difficult in a way because I love to see kiddos in person, but also gave us so much more access. So just know that I'm there as a resource for you.
Awesome. And then I just wanted to double check one thing because I don't know all the rules in all the states, but even if, so we love pediatricians, right? Like, again, team approach is so big. For me, obviously for you, it's on your website as one of your highest values. But I do see a lot, and I'm sure you kind of alluded to this too. If there is a mom whose gut is saying, like, I'm almost getting the chills right now and like getting a little teary-eyed because it just happens so often. There's like a mama right there and she's like, I just feel like a physical therapist. I want Anna to look at my kiddo and just see if there's anything going on. But maybe the doctor with the best intentions in the world was like, oh, don't worry about it. It should be fine. Like, you don't need anyone else's expertise on it or whatever.
Right.
And the mom still is like, I respect the doctor so much, but could I still call Anna
Yeah.
and maybe schedule something? Or do I have to listen to, oh, don't worry about it? Like, could I make a different decision?
You bring up a very good point. Pennsylvania does have direct access. So you don't need a doctor's referral to get an evaluation, and I am able to treat you for 30 days until we would need a referral. And if you are in a situation where, the doctor may not be agreeable, like you said, for whatever reason, with the best intention, sometimes, you don't want to worry parents, and sometimes you really think that there's nothing wrong. So, if we do need the referral after the 30 days, then I definitely am very open to communicating with your doctor and explaining what I see and why. And within those 30 days, your child would have already made progress, if not achieved their goals. So if care needs to be ongoing, then I always communicate with doctors, because again, it is a team approach. And working together, we're really going to accomplish those goals so much faster.
Awesome. Well, Anna, I feel like we covered it all, and I had an absolute blast chatting with you. Anything else?
Awesome. Thanks for having me. No, thanks for doing this. I love the network that you're building, and we have the same mission, which is supporting parents, right? So we support each other as therapists, and we support parents, and it's an awesome job, right? If you love what you do for a living, it's not really work, right?
Right. And I think people can tell too. I think they can really tell. And so hopefully that's our hope, that we're able to express that to you all. And that, again, if you have any questions though for Anna, make sure you drop them in the comments, or we'll link all of her information in the description so you could go to her directly. But if you do drop anything in the comments, I will make sure that she also gets it and knows about that as well. All right. Well, Anna, you have the most amazing evening.
Thank you so much. You too.